You know, I have found times where people need a little more help than you would think. They're not sick when they're grieving, but it's going to take a little more to get them on the right path.
There we go. Well, welcome to Grief and Loss Today. I'm Donna Brandenburg.
And I'm Andrea Harris.
Well, let's explore this.
Well, the trick is to know when that is happening. And that's not always real easy to know because grief feels so unfamiliar to us that we feel crazy when we're grieving. And we sometimes think we're crazy.
It's out of control.
It's out of control.
Feeling.
That's right. And we don't know, is this normal? Is it not normal? And so it's very important, if we're wondering about that, to get someone to help us to be able to assess it, to look at the situation and tell us if this is going to take some extra help or if it's going to go okay.
Mm-hmm. There's a natural progress or a progression there, and some of it is just time.
Yes, time is a great help, but it doesn't heal. If you have moved into more, say clinical depression or getting stuck in the grief process, sometimes there are medications that can help, counseling can help. A combination of the two is the very best prescription, actually.
Okay, very good. Well, we have an article here about predisposition, assessment, and treatment issues for prolonged grief disorder. How would a person know if they're getting close to like a grief disorder? What are the warning signs?
Well, the most usual one would be the sign of depression. And if you feel like you're in a pit and you cannot scratch your way out of it, it's different. It's different than normal sadness of grieving. You are not interested in the future. You might even have thoughts of hurting yourself. Those are red flags right away. If you ever think about hurting yourself, you need help.
Immediately.
Immediately. Call now when that happens. But it just feels like there's no tomorrow. I can't get past this. And there's very, very solid help for people who are in that state.
Have you had an example of someone that's had that we can kind of do kind of like a case study?
Well, I do remember one lady whose husband had died. She was sad, of course, and I saw her right along the time, and that was important because there came a time when her symptoms went from sadness to true depression. And at that point, I was able to say to her, and it was about 6 months in, and I was able to say to her, you crossed a little line. You really are depressed. I think we need the bump that an antidepressant can give you. And she did, and by golly, much better very soon.
Is that prolonged grief disorder, that is more of that's one step past depression is what I'm hearing? Or is that something that depression morphs into?
It morphs into the depression, the prolonged grief.
Grief comes first. Then.
Grief comes first, and it can morph into what they are defining as prolonged grief disorder. And that would be the depression, the excessive anxiety, and so forth, that you just don't feel like you can move past this situation and you need some extra help.
Okay.
Now, they have done studies that show that people in these situations, that the incidences of suicide can be higher, the risk of suicide and other things like that. So even though I have mixed feelings about calling grief a disorder, it just goes against my grain, but getting help doesn't. We need help, whatever you're going to call it. Sometimes we need that extra help and deserve it.
Well, that's good advice. We're talking about an article that we have, Predisposition, Assessment, and Treatment Issues for Prolonged Grief Disorder. You can check around on our website. There are more resources here. And once again, our job is to help you grieve and help the people around you.